Michael Jackson sang about starting with the man in the mirror, but ongoing plastic surgery and now talk of anorexia may mean he spent too much time thinking about his own reflection. Dr. Aleksandra Drecun here to talk about the disorder that may have plagued the pop king, and we don't know if he was actually diagnosed with it, but it's BDD. And Aleksandra, tell us what that stands for.
BDD stands for body dysmorphic disorder. It is a psychiatric condition in which the individual who is affected is excessively either concerned about or preoccupied with their physical features in a distorted way. So it's usually somebody that's of normal or very high attractiveness who finds that they are so ugly and defective that they find themselves as being hideous, and to the point where they're in so much psychological distress that it impairs their occupational or their social functioning, and they socially isolate and become a recluse.
Wow.
In fact.
Wow. And you have worked with patients that have been diagnosed with BDD, and you said that sometimes it can go hand in hand with anorexia.
It can. We find that both anorexia nervosa, which is a fear of becoming fat, where people maintain a lower body weight for their height and their age, and we find that it's a distorted body image. So even though somebody can be emaciated, very thin, they still see themselves as obese. We find that BDD works the same way. It's this disillusion of, I am really ugly even though I don't have a defect in my physical features. So it could be something specific just as one area of the body, such as the nose or the lips or hair, skin, or it could be several complaints, or even it could be a general appearance.
So here are some of the signs of BDD, and like we talked about, checking in the mirror, but also you were saying sometimes folks that have this don't do that at all.
Right. They could either check on any surface that has a reflection, and they tend to spend about an hour or more in terms of checking the mirror, or they might completely not want to look at themselves because they find themselves as being really ugly, and so they might remove all of the mirrors from their home.
Oh wow. Okay, so just maybe not have any mirrors in the house at all.
Right.
And camouflage, I mean, like, are we talking about just wearing huge baggy clothes, just, you know, not letting anyone really see what their shape is?
It could be that, or it could be a flamboyant, flashy look to distract from an area that they're concerned about. When we're talking about camouflage, it could be within makeup, cosmetics, it could be with plastic surgery, it could be with dermatology procedures, it could be anything, it could be a hat, whatever it is.
We have seen with Michael Jackson some of these behaviors that were exhibited, and again, we were talking before the segment that, you know, he was never diagnosed, or we don't know about it if he was because of all the confidentiality. But what do you do with patients that are diagnosed that come to you with this?
Well, often they're treated with two avenues. One is psychotherapy, which we use an approach called cognitive behavioral therapy, and then also they are sent to us for a psychiatric evaluation and given what we call SSRIs, or antidepressants, medications that focus on depression or anxiety, and we use the two together.
I know you've worked with a lot of patients. Any specific stories of clients that you've worked with that have had positive outcomes, really being able to break through the barriers of BDD?
Yes, it is a difficult diagnosis to work with, and in fact I do have a client currently who is a beautiful young woman who is, I would say, 5'2", 100 pounds, just really gorgeous, and she thinks of herself as being ugly in general, not only externally but also internally. So we find that this condition affects people's self-esteem because we tend to place a lot of value on our assessment of how we look, and so if we think that we are ugly, then we're obviously not going to feel good about ourselves.
So seeking professional help, it sounds like that's really sort of where it all begins, to see if this is a diagnosis that you, a friend or a family member, could fall in.
Right. I mean, if you're seeing any of the signs that we mentioned before, it would be a great idea to send somebody in to get a clinical evaluation to find out if there is something going on. I mean, it's better to rule out the condition and make sure that the person doesn't have it, and if they do, that there is help available. I mean, that's really the point here, is that this can be worked on and it can be fixed.
Right. And taking some of the shame away. I mean, of course, it would be really hard to talk about this and open up to another person about this. So we've got your information up here so folks could get in touch with you, because, you know, you want to help people and you want them to know that there are some things that can be done to, you know, live a healthier life.
Absolutely. There's a lot of shame and secrecy that surrounds this diagnosis, and people don't tell others because they're worried that they'll be seen as vainful, or they're really embarrassed about it. And so they keep it to themselves, and we find that people don't know that there is assistance available or that they're willing to share their concerns with others.
Well, Dr. Drecun, thank you so much for joining us today and explaining all this and breaking it down in simple terms for us.
Thank you.
Good to have you on today.